On behalf of everyone gathered here, I take great pleasure in inaugurating this Hope, Finding Hope India and Foundation for Hope Healthcare and Diagnostic Lab today on the 22nd February 2024.
Well, today we gather to celebrate a vision turned into reality, the inauguration of Finding Hope India and laying the foundation of a stone of foundation for Hope Healthcare and Diagnostic Lab at Naga United Village. This is more than just an event, I believe. It is a celebration of faith, unity, and also a healthier future for our community.
I stand here on behalf of Naga United Village. I extend my profound gratitude to the concerned people, particularly Dr. Nathan Mariel, founder Finding Hope, for bringing this great mission to Naga United Village. Naga United is a village where a mixture of people are living together. And I should say, this village is one of the fastest growing and developing village in this area. In the midst of many development, you have brought this great mission to our village. Thank you once again. Your choice to bring this mission to Naga United Village is a profound gesture of trust. And the establishment of this mission is a testament to this unwavering dedication, ensuring that underprivileged and needy people across our nation receive support, help from your mission. May the good Lord richly bless your mission in order to bless others.
Well, while my wife was undergoing her treatment in Guwahati, I was so grateful that despite the burden, we had somehow gathered the resources to keep her care going. But in that moment, my heart also broke because there are so many people who are not getting the basic medical attention they need because of lack of finances and resources. That evening in the month of October 2024, as we talked quietly about a journey, something powerful clicked between us. We both knew that if we had the means and the resources, we could make a difference. Together we came to a shared vision, a charitable health clinic, a place where people could receive care no matter how challenging their financial situation may be. So this dream was born out of a personal journey that changed our lives forever. Out of pain, something beautiful emerged. This healthcare center is my way of honoring my wife's courage and resilience. It is my way of standing up to those who feel forgotten and deprived. This mission may be big, but it is possible. And together we can make it happen. With Finding Hope Global, we will bring change, inspire hope, and transform lives. Together, we will make a difference. Finding Hope work is nothing short of inspiring. In communities across America, Romania, and Brazil, they have already transformed countless lives. Through children's home and school for unprivileged kids, they have provided not only just education, but a sense of belonging and hope for a better future. I have seen, my wife and me, we have seen the impact firsthand, how they give abandoned children a place to call home, how they nurture young minds with love and guidance, and how they empower community to rise above the struggles. Their commitment to serving others is a powerful testament to what faith and compassion can achieve. When I approached the director of Finding Hope, Dr. Nathan, with this idea, his response was immediate and unwavering. They brought not just the resources and expertise, but also their hearts. Together, we are determined to make this healthcare center a place where lives are changed and hope is restored and where healing begins. This healthcare is for the father who skips meals to buy medicine for his child, the mother who suffers in silence because she cannot afford treatment. It is for the laborer who works tirelessly every day, pushing through pain because there's no money to stop work and seek help. And for the elderly person who prays for relief, but has no one to turn to. Now, these are not just stories, these are realities, real people, real families around us, around this locality, suffering quietly, hoping someone will notice and someone will care. We are committed to making healthcare more accessible and affordable to economically disadvantaged individuals and families. As part of this initiative, we aim to provide significant discounts up to 60% on consultations, medicines, and diagnostic services. In selected cases where deemed necessary, these services may be offered free of charge, ensuring that the financial constraints do not become a barrier to essential healthcare. We expect the center to be operational in maybe the next few months or so. So friends, let us join hands to bring hope, healing, and love to all who walk through the doors of our center. Your belief in this mission is what makes it possible. And of course, to my wife, you are my inspiration, my strength, and she is the reason I stand here today. May this center be a beacon of light for generations to come. This is a day of a vision of healing born from love. Thank you.
Anyways, I'm here to tell you a little bit about Finding Hope and who we are, and maybe a little bit about the connection that we've made with Jan and his family, how it happened. So I'll begin with Finding Hope. We work in Romania, that's in Eastern Europe. We have children's homes for children, orphan children that have been abandoned. Then we have about around 40 children total within 3 homes. That's how we started. We started with these children's homes. My wife was an orphan. She grew up in children's homes and she wanted to give back. So I had been doing business in Romania, and when I was doing the business ventures, traveling, we do a lot of import-export business. She brings kids in the home, and before long we had 1 kid, more kids, and then we had 40 kids in our home. And so I had to make a nonprofit. So we made this nonprofit in Romania with helping orphans. I never really intended to make a nonprofit, but it just sort of grew organically from my wife's heart and eventually into my heart. I had as you mentioned, I'm a doctor. I studied medicine. My intention was to go into medicine and become a doctor. I worked a little bit in the United States as that, but eventually I found myself in Romania because of the business, and my wife got us involved with the orphans and started children's homes. And it just grew, it wasn't a planned thing, and I think that's how life happens a lot of times. Opportunities come and events, life pulls us in directions. And I just knew this is where I needed to go. I needed to give up my work as a medical doctor, and eventually I even gave up, this last year I gave up my work at doing business. So now we operate full-time as a nonprofit. We have our children's homes in Romania, but not only Romania, me as an American and United States citizen, we are, as our nonprofit, we're based out of the United States, so we're incorporated there. Their funding is a little easier because it's a prosperous country. So, and in addition, we also have work in the United States. We have children's homes. We're starting children's homes in the United States, camp facilities. In addition to the United States, we have launched last year our work in Brazil. We're starting we have a community center there at it currently with an after-school program. We work in the slums. We get the kids from the slum areas, what they call them favelas. We bring them in and help get them educated in our after-school program. We also have a piece of land. We're developing a school, a private school for these kids from the slum areas that don't have access to education. This is in São Paulo, Brazil. And lastly, we're here. Back about, I would say 5 or 6 years ago, Abane and Jan, they came to visit us in Romania, to see our work in Romania with these children's homes that I was speaking of. It was, they didn't know me. We have this program online and a volunteer type of thing. They came and we just hit it off. You know, you just know that this is going to be a relationship that is going to last and it's going to do amazing things. And for 5 years we spoke and talked about potentially doing something one day. There was no hurry. We were just waiting for the right moment. And last year we determined this was going to be the moment. You know, we're going to do something this year. We're going to do something. We're going to partnership. We're going to, and as Jan mentioned, we had talked about doing this children's home here, just like similar to what we have in Romania for children that need homes. But again, I don't want to rehash what Jan said. Things came up with Abane's health, and it took a different trajectory, which was fine. And in a sense, it was maybe for the better. Because me as a medical doctor, I have always wanted to do medical clinics. In fact, we did medical clinics many years ago with my father. When I met mostly him, we set up medical clinics in the jungles in Venezuela, the Amazon jungles. So we had experience in this. And I was young then. I wasn't really, I think early teen years, probably 18, 17, 18. So I wasn't really integral in setting it up, but I hadn't seen it. And I thought maybe one day I would like to do that, especially with our medical training. I have a lot of medical connections in the United States to do this. So it just seemed to fit. And I think it's going to be a real blessing for you guys. It's going to take some work with any nonprofit, with any venture, with any sort of cause or work. It takes work to get it off the ground. Once you got to get funding, you got to get organization, you got to get teams, you got to get networking. Once it gets off the ground, it's going to go. It's going to be a blessing. You know, things they start out as visions. They start out as visions in our mind and desires or proddings in our hearts. And then eventually, little by little, step by step, it comes to fruition. But we continue forward. And that's how it's been with my life, with all of these nonprofit endeavors we're working at. The homes in Romania started out as visions. The school in Brazil started out as a vision. It starts out as just sitting around a table. I believe probably Jan and Abane we're sitting around a table in Romania and discussing maybe one day we'll do something and envisioning how it could be. That's how I started in Brazil, that's how I started in Romania, that's how I started in our work in the United States as well. It starts out as just talking between friends. But before long, one step leads to the next, one step leads to the next, one step leads to the next. Before long, there's a ministry called Finding Hope. And we're all over the world now. Growing big. I never thought that I would have something so big. I would be the leader or founder of something so big. It just happened. But it all started out speaking at a table somewhere. I was talking to one of my friends. And that's the same way it happened with Abane and Jan. We're just talking, and now we're here today, 5 years later, and the vision's starting to be realized. The first step is starting to be taken. And that to me, when I step back and I look at those days, I said, that is amazing how that can become from an idea in the mind, from a desire, that it can be realized. And I can be standing here in front of you guys in Naga in a place I've never been before, with my family, with my team, people I don't know, talking about something that's going to happen. And then years down the road, I'll probably be back here and there'll be a full-fledged clinic going on. And who knows, maybe Nagaland will be revolutionized in ways that we can't even understand because of a connection that was made between Jan and Abane in Romania and a connection with the United States or whatever. It starts out like that. We don't know where it's going to go. I just know one thing I feel in my heart. It's gonna be big and it's gonna be amazing. And you guys are going to be blessed and we're going to be blessed. And what we're all about is finding hope. We bring. For me personally, want to build people's dreams. I want to bring hope to people that need hope. That's what we're all about. We do that with orphans in Romania. We do that with the kids in slums in Brazil. We do that with our kids in the United States, where we have homes for them as well. Camps. Our camps are offered to kids that can't pay for camps. It was the same thing here. We want to bring hope to you guys. At least, be part of bringing your hope. We can't do it all. We can bring funds, we can bring teams, we can collaboration. You guys are the ones that are actually doing it because you live here. But we want to be helping whatever way we can to bring hope to people that need it. For example, when you're like John was saying, I figure, you guys have good health care here, but how much access does everybody have to the good health care? I figure for the disenfranchised, for the marginalized people, is difficult. So if we can assist to to help them in that endeavor, we feel really blessed to be able to do that. I know, as a healthcare provider, over the years, it's a very stressful thing. And I'm sure Abane and any of you guys that have had health problems, it's a very stressful thing, and you really don't understand it until you're going through it. And the worst thing is when you don't have money, you don't have means to get that health care. The most insecure thing in our lives as humans is we want to survive, and we want to persist, and we're afraid of death, and afraid of disease and pain and whatnot. And we reach out to medical professionals, we reach out to health care. What else can we? That's what we do. But when you don't have access to that, it's really stressful psychologically and ultimately physically. So to be able to be a part, to give hope to those people is a very privilege indeed. And I just want to thank you guys, Jan and Abane, and all of you that are a part of this, that thank you for giving us the privilege of collaborating and being a part of what you guys are doing here in Nagaland. I just personally feel like it's a privilege. And we look forward to the great things that's going to be done. And I just know again, we're just starting out here small. Things grow bigger and bigger and bigger, and eventually, who knows, we might have a hospital with all sorts of surgical suites and bring in doctors from all over the world doing specialty surgeries, heart transplants, who knows what. But we're just at the start. So I hope to be back, and I hope to be back next time, and we'll have something taken off, and it'll be an amazing thing. So thank you all for having me. I hope to meet every one of you and get to know you, but appreciate it. Thank you.
It's indeed a pleasure to be in your midst this morning. Good to see all of you. At the outset, Dr. Nathan has just mentioned about the foundation. He has made us aware of how this has begun and how this is really working across the globe, giving service, rendering service, incredible service to people around the world. And it has come to Nagaland, it has come to India, it has come to Nagaland now. So we are really grateful to Finding Hope organization for the service that you are rendering and for bringing to Nagaland and for your decision to establish this Finding Hope India and Foundation for Healthcare and Diagnostic Lab established here in Timor. This shows that your commitment is really extending the healthcare where it is needed most. I would also like to thank the organizer of this program for remembering me and giving me the privilege to inaugurate this noble initiative this morning. Thank you, Apollo, for the accolade that you had showered on me, which I don't deserve, really. But it is indeed truly an honor to be in your presence this morning, this time before you, as we mark the beginning of an institution that embodies service, healing, and transformation. This institution is more than just opening of a facility. It's not just opening of a facility. It's launching of a mission that promises hope, health, and healing to the countless individuals around the world. It is also noteworthy to mention that this institution, this Fighting Hope, and this very diagnostic lab is brought by a family, an individual who has received hope, health, and healing. It's really wonderful, and it's really befitting that somebody who has received healing has brought this, and she's going to run it. The family, the husband and the wife is going to run it. So it's really, really great, and I wish the both of them a very successful venture in the future. As we all know, in a world where quality medical care remains out of reach for many, initiatives like this brings light, a beacon of light, proving that compassion and commitment can truly make a difference. For those of you who are coming from outside, Dimapur is a city of diversity and growth. This is the only city in Nagaland which provides medical care to the rest of the districts in Nagaland. And we, in spite of the medical care facility that are provided here, we also face a lot of challenges. One of the pressing challenges is the accessible and affordable healthcare that is lacking in Naga. So establishing this Foundation for Hope Healthcare and Diagnostic Laboratory is a significant step towards reaching that care. I would appreciate and also thank the founder of Foundation Fighting Hope, Dr. Nathan, for this visionary leadership that you are providing and for coming up with this beautiful and very noble venture. As I see, you have and the organization has spread to 5-6 countries, in India being one, and also reaching Naga. This is a wonderful job that you are doing. You are not only providing healthcare services, but you are also taking up a lot of other philanthropic works, like orphanage, running orphanage, and things like that. So this is a very wonderful job. I must thank you and also appreciate your initiation. It only proves your hard work, dedication, and belief in a better future, which have led us to this moment today. This laboratory is going to be run now by the doctors, the nurses, technicians, and staff who will serve here. You are more professionals. You are lifelines to those in need. Your dedication will not only heal bodies, but also ignite hope in the hearts of many. Healthcare, as we all know, is a shared responsibility. It requires collaboration between the government, private institutions, NGOs, and the communities. We all have to come together. I am also happy that the village council of this United Naga village has also shared. They are also here, and they have also assured of their participation and also their support to make this institution run efficiently and for the benefit of everyone. As a government, we are also committed to strengthening the healthcare service system in Nagaland. We also would like to improve the infrastructure and the supporting initiatives that the government is uppermost in our mind. For instance, a lot of initiatives we have come up with, the present government has come up with a lot of initiatives. Like one notable initiative is the Chief Minister's Health Insurance Scheme. That is to give coverage to insurance coverage to the government employees and pensioners, and also for those who are not covering under this, Ayushman Bharat, which is also a centrally sponsored scheme, Ayushman Bharat, to give health insurance coverage to every citizen of the country. So these are some initiatives that we are taking up, and also the state government is also partnering with a lot of private organizations, charitable organizations in Naga. We are working together, and also, as I said, we also try to bring in a lot of external level projects, foreign funding for health, for improving our health delivery mechanism. So these are the initiatives being done. I call up all the stakeholders, all of us present here. This institution cannot be run, or even the government's initiatives cannot be run by us alone. It requires everybody's involvement. We all need to collaborate. So I also request the village council here to give support in running this facility to ensure that the facility reaches its fullest potential. Dimapur is also a city where all Nagas, for any body in need of medical care, they come down to Dimapur. But not everybody can afford to come down to Dimapur. Those who can afford, they go beyond Dimapur also to Guwahati and also the other metropolitan cities in India. But there are many in the rural areas who cannot get access to medical care. We have to think for them. I, as an elected member, I'm also quite concerned about the health care service, especially in the rural areas. We fall short of doctors, the medical officers. Many of our PhDs, many of our hospitals are without doctors. We lack professionals. We lack infrastructure. Much as we want to develop, we don't have the resources to develop our own infrastructure. So many of our hospitals are without proper sanitation. So this is where our support comes in. And also, the government alone did not be able to build or strengthen this infrastructure. So I call upon everybody, every citizen, to please join in, give your support in whatever way possible. We only look at the government to provide everything, but we are the government, people are the government. So I request every citizen of the state to come forward and give a lending hand, see that our medical healthcare delivery system is improved. All of us have to come together. So with these few words, may this Finding Hope India and the Foundation for Hope Healthcare and Diagnostic Laboratory serve the people with dedication and excellence. So with these few words, I thank once again for inviting me over and giving me the privilege to be a part of this solemn, yet a small gathering, yet a very solemn function. So I'm really privileged to be a part of this initiative. Thank you very much once again. God bless us all.